Good evening. Tonight we are coming to you from C-Care IHK here in Namuongo, and we are in their aesthetic spa here. I'm with Dr. Lubega William, a plastic and cosmetic surgeon, and he's going to explain to us more about plastic surgery.
Plastic surgery is actually a branch of surgery that specializes on trying to restore form and function for people who have had accidents, people who have had suffered from diseases, people who have had industrial trauma, and people who just want to change their appearances. There are also some people who are naturally born with birth defects. You've seen children with cleft lip or some children born with cancers. We are able to reconstruct them and restore their confidence and self-esteem by adjusting how they look like and making sure that they can easily not be segregated against in the community as a result of their looks. And when you talk about cosmetic surgery basically focuses on how somebody looks, focuses on how your face, you've seen women who want to do how their faces, they want them to glow, they want to have a shine, they want to change their noses. Some people want to have bigger lips, others want to have smaller lips. There are women who have delivered and you feel like after delivery your breasts are sagging and you want to be able to lift them. We do what is called a mommy makeover, because after delivery almost everything about you changes. Your abdomen changes, you have a lot of loose skin, your breasts are changing, and you want to be able to improve the appearance even after you've given birth to return to normal. And there's also other people who may want to have, either somebody is not comfortable about their arms. There's some people who have very big arms and they're not comfortable about them. They want them to have them be reduced. They've been to the gym and they can't firm their arms. The other people are not happy about their buttocks. They want bigger nyash, as they call it, bigger bums. So all that is under cosmetic surgery. Okay. You can be able to do that.
Many of those things that you talked about, trying to look like they target women, but are these also things that could be done on a man, for example? Have you seen men come to you for those services that you just talked about?
It's interesting. One of the most popular surgeries that we do for men is gynecomastia surgery. However much somebody goes to the gym, he still has breasts that protrude and they appear very feminine. So we're able to do that. Then also we're able to do 6-packs for the men. Some men, however much you go to the gym, you're not able to have the kind of body that you'd like to have. So we are able to do, it's called abdominal etching, and we're able to create the 6-packs. There are also some men who, despite going to the gym, you still have a big tummy. You're not able to get rid of your tummy. So you can actually do, there are men who do tummy tucks as well, to be able to reduce the size of their tummies. We also do certain procedures for obesity, like the gastric sleeves, so that way somebody is able to holistically lose the weight as well. So we do, that's under bariatric surgery, we're also able to offer that. Okay. So somebody is able to lose weight.
Please explain to us, are these things complementary, or should I just, take it for granted that, I could just leave my body grow anyhow, and then because I know at one time I could be able to do surgery, how should it work?
So most times, once you undergo these procedures, like I always tell most of my clients, that when you're undergoing any cosmetic surgery procedure, it's just to help you accentuate your body. It's not a solution, for example, for weight loss. I can't eat, I know when living a sedentary lifestyle, eating all the fatty foods, I'll just go and suck out remove the fat. But that also, because every time you undergo any procedure, there are certain complications and risks. You're exposing yourself to those risks. And also, once you do these procedures, they're very expensive procedures, you want to be able to maintain the body that you have. So despite the fact that you're going to do a tummy tuck, you're going to do a liposuction, you need to also have a lifestyle change. You need to still go to the gym, you need to still have a healthy diet, you need to take care of your body.
Yeah. When your patients come to you, how do you tell them to prepare for a given surgery? You could just, choose from your list.
Okay, I'll just speak generally about preparations for surgery. So one, it's not everyone who comes to us is an ideal candidate just because they have money and just because they have a problem that they want to deal with that will take them on as patients. Because these procedures are surgical procedures. Yes, we have surgical and non-surgical, but there are complications that may arise. If somebody has a cardiac disease, if somebody is diabetic, if somebody has poor healing, they're not good candidates for these procedures. But also the mental status of somebody. There are some people because each of us is created uniquely. So just because a particular film star I see on TV has a particular body, it doesn't necessarily mean that also your body could look like hers. So we need to make sure that you have realistic expectations of the surgeries. Because sometimes, that's why some people keep going in and having as many cosmetic procedures, and that way they get several complications because they're always going in for surgery. They don't know exactly what they want, but also because they have unrealistic expectations. So if you don't meet the psychological criteria, then we won't be able to operate on you. Then also, cosmetic surgery is not an emergency. So we undergo a certain period of time, sometimes even 3 weeks to months, trying to prepare the patient for the surgery. It's not like you'll come in today and you'll have your surgery today. No, you'd have a review by the physician to make sure you don't have any other illnesses. You'll have a psychological evaluation to make sure you're psychologically fit. And also you'd have a consultation with the cosmetic surgeon so that now we can be able to plan and agree with the client on what kind of procedure you're going to have and what kind of complications you may have out of this surgery.
How does one handle post-surgery recovery?
Most of these surgical procedures are in hospital for about 2 days. Even after you've had the tummy tuck or liposuction, the maximum you can go if there are no complications about 2 to 3 days, and then we discharge you. Then you come in as an outpatient, and we're able to follow you up almost for a period of, depending on the procedure that we have done and how long you take to heal. So you may be followed up for about 3 months or 6 months.
Walter Mwesije, NTV.
Thank you.